and it just looks identical to a physician's office. The only difference is we have a camera in there and we have a microphone in there. So when you're in there with a standardized patient, doing a standardized patient session, we're going to record you. And after the session is over, we're going to give you the DVD. And what you'll do is you'll meet with the physician for 2 or 3 or 4 hours and go over this DVD. And they will help you determine what you did wrong, what you did right, and how you can improve. So when you come back the next time to do a standardized patient session, you're going to look at this DVD probably 3 or 4 times right before you come back. And the improvement between the first time and the second time is like night and day. It's tremendously impressive. It really, really is. That's the first semester. Second semester, you're going to learn how to do basic physical exams on each other, as well as standardized patients. You'll get another shot with standardized patients doing a basic physical. Then in the second year, first and second semester, you learn how to do some of these sexy physicals, you know, the geriatric physical, the breast exam, the prostate exams. All these different exams you're going to learn how to do on each other, and in the case of the breast exam and pelvic exams and things like that, you're going to learn how to do them on standardized patients. That's our standard, our clinical skills course. Now, last year, when we graduated our second class, we were the highest in the nation as far as that part of the PE, the physical exam part of the exam. We had a 98.4% pass rate on that part of the exam, simply because the program that we have seems to work fairly well. In addition to that, in addition to those 3 courses, we also have a very, very basic anatomy course. It's only 10 weeks long. Now, because at most medical schools is 25 to 30 weeks of anatomy. This is only 10 weeks. You might want to ask, well, how come only 10 weeks? Because you're going to have anatomy in every case for the first 2 years. You're going to have an anatomy in the clinical exam portion of the curriculum. You're going to have a lot of anatomy in the osteopathic medicine course. You will be experts in anatomy. That's why DOs who graduate from or doctors who graduate from a problem-based learning curriculum using this kind of a format do very, very well in radiology and in surgery, simply because their anatomy is top of the line. In addition to these 3 major courses plus anatomy, we have some small peripheral courses. And these courses anyway from 8 to 10 to 25 hours in length. And they're real small courses: spirituality, medicine, human sexuality course, medical ethics course, healthcare management course, which I think is the best course on campus because I teach it. But this healthcare management course, you'll learn about malpractice insurance. You'll learn about something called ICD-9s. That's how doctors bill. You'll learn about the Stark laws, Stark 1 and Stark 2. You will be very, very well trained in this peripheral part of medicine by the time you hit your rotations on the 3rd year. Speaking of the 3rd year, in the 3rd year you're going to be out of the classroom, you're going to be in physicians' offices, you're going to be in hospitals, you're going to be in clinics, and you're going to be doing various rotations. Each rotation is 4 weeks long, and there are 12 rotations that you have to do. 9 of them are required, and 3 of them are elective. The 9 that are required are, you'll do 3 in internal medicine, you'll do 2 in surgery. You'll want OB, peds, family medicine, psych, and pediatrics. So you'll do 9 required rotations. The other 3 rotations will be elective. If you want to be an anesthesiologist, well, you do 3 rotations in anesthesiology, if that's what you want to do. In the 4th year, you have 2 required rotations in emergency medicine. You have all the other rotations that you have are electives or C-electives. Pick and choose what you want to do. In the 3rd and 4th year, we're affiliated with almost 160 hospitals all over the United States. And you'll do your required rotations at our affiliate hospitals. Your elective rotations, you pick and choose where you want to go. I just wrote three letters just Friday of last week for our students to do rotations at the Mayo Clinic. They go to the Mayo Clinic, they go to Johns Hopkins, they go all over the United States doing rotations. That's a little bit about our curriculum. The program that we have, I think it's a very, very good curriculum. That's why I'm there. And I think, quite honestly, this opened many, many doors for you. Just for information, when you graduate from an osteopathic school, you can do an osteopathic residency program. You can do an allopathic residency. By that I mean a DO and an MD residency. Or you can do a joint residency, a DO/MD residency. So you're if you do a DO/MD, you're certified by both osteopathic boards and allopathic boards, DOs and MD boards. Anybody have any idea what kind of docs you want to be? Yes.
Surgeon.
Surgeon? Good, good. I think I mentioned it before at orientation. A lot of people want to be pediatricians. Probably 3/4 of the class want to be pediatricians. Well, last year we had 9 people going to pediatrics. Now, on the first day of medical school, we probably had 99 that want to be pediatricians. They found something they liked better. I have 2 kids. Both of my 2 kids are DOs. Well, my daughter, all of her life, she wanted to be an OB-GYN doc. That's all she wanted. To deliver babies and take care of mommies. I've heard that so many millions of times. I'm sick of hearing it, quite honestly. But that's what she wanted to be. She wanted to be that through junior high, through high school, through college, through medical school, up until the next to the last rotation of her 4th year. And she fell in love with one of her classmates, and he wanted to be an FP doc, a family practice doc. So she gave up her residency in OB-GYN and did a residency in family practice. She changed at the very last minute. My son, he wanted to be a dermatologist. Because, you know, Dad, I'm working real hard here in high school. And I know when I go to college, I'm going to be working real hard. And medical school, internship, and residency, I'm not going to have life. So when I finish my residency, I want to be a dermatologist. I want an easy job. I want no stress in my life. I want to kick back and relax. I want to take care of patients 3 days a week and golf the other 4. He is an emergency medicine. He finished up his residency last year at Arrowhead Regional Osteopathic Residency Program in San Bernardino County, California. This year he's doing a fellowship at UCLA in ultrasound. And at this particular fellowship, there were 61 people that applied for this fellowship. 58 MDs, 3 DOs, he got it. So it doesn't really make a difference what initials are behind your name. It's what you do to prove yourself to the people that you want to apply to for these different residencies. 87.4% of our graduates last year got the first or second choice of residency programs. Now, when I first moved to Florida, I was at the campus before there was a campus. It was a little dirt, that's all it was. So the one guy that was there with me, he and I sort of made predictions as to what's going to happen with our first 2 graduating classes. And my thoughts were, we're here, it's going to be a brand new school. Nobody knows anything about LECOM, Bradenton. So what happened, most of the docs will probably go into family medicine, and they'll do their residency at Bob's Hospital, or Bill's Hospital, or Harry's Hospital, some of these little no-name hospitals. Well, I was wrong. Because they did so well on the boards and so well in their training, they went to some of the best programs in the country. They went to Johns Hopkins, they went to Duke, they went to Cook County, to University of Tennessee. We had 7 of them that went to the Mayo Clinic. University of Florida, we had 9. So they went to all these top shelf programs in these really neat, sexy specialties. They went into neurosurgery, plastic surgery, ENT, orthopedics, internal medicine. The largest number of graduates went into emergency medicine last year. The second largest was some of these sexy surgeries. Third largest was internal medicine. Fourth largest was psychiatry. The 5th largest was family medicine. Now, speaking of psychiatry, we had, last year we graduated a class, we had 9 students that came to our medical school with a degree in psychology. And they all wanted to be psychiatrists. Not one of them found something they like better. So when you do get into med school, please, please, please keep an open mind. Because you might find something you like better, like my two kids did. Like all these students that came want to be pediatricians. They found something they like better. And psychiatry, that's a great career. San Bernardino County in Southern California is looking to hire about 130 psychiatrists. There are no psychiatrists out there. And what happens, because there's not a lot of psychiatrists, all the mental health training falls onto the shoulders of family practice docs and the interns. Quite honestly, they're not trained for that. But they got to do what they have to do the best they possibly can, because there's not a lot of psychiatrists around. Let me tell you a little bit about our tuition. We are the fourth least expensive tuition in the United States for out-of-state students. Our tuition is $27,000 a year for in-state, $28,000 for out-of-state. So when you graduate from medical school, you're going to defer all your student loans through internship and residency. The government is going to pay for all the interest on these loans until you finish your residency program. Then what will happen, then you have to start paying them back. Well, at a $28,000 tuition for 4 years, you'll be paying back approximately, at the current rate, approximately $1,280 a month for 10 years. A lot of money. But if you go to a medical school that the average tuition is $48,000 right now, you pay back over $3,000 a month. That's $1,800 a month different for 10 years. Now that's a mortgage payment. So when you go to med school, my suggestion is you pick a med school that does well with the graduates. They get the first or second choice or residencies. Pick a med school that tuition is low enough that you're going to actually be able to afford to go there. Now, 2 years ago, one of our graduates, he fell in love with one of the, a student from another med school. And this particular med school, I don't want to say where it is, but the tuition was $61,000. $61,000. So he and they fell in love on third-year rotations in the same hospital. The doc that was there teaching both of them, he was teaching one from our medical school, where the student was paying $26,000 at the time, and then from the other medical school, the student was paying over $60,000 a year. So in the third and fourth year, you're going to be with a lot of people, and your tuition will be a lot higher if you go to a different school. Anyway, he graduated our school. He was $130,000 in debt. She was over $270,000. Think about that. It's important. Let me give you what I call Brezhnak's 3 rules of med school. You follow these 3 rules and you'll be a happy camper. You get through med school without any problem. First rule is you don't piss off the boss. Now, who is the boss? The boss is the dean. The boss is the faculty member. The boss is the lab tech when you're on rotations in the hospital, because they can teach you so much. You piss them off, they're not going to teach you anything. A nurse, you never want to piss off a nurse. And you know why you never want to piss off a nurse? Because when you're in a hospital and you're on night call, and you want to get some sleep, you piss off a nurse, she will page you every 10 minutes to let you know the patient is doing just fine. Never piss off a nurse. Number 1 rule. Number 2, make a copy of everything. Because you're going to give something to me, I'm going to lose it. You're going to apply for your license, it's going to get lost in the mail. You're going to apply for hospital privileges, and your folder is between 3 different committees in the hospital, and they can't find your folder. Now you have to start all over. Make a copy of everything. Number 3 rule, only join organizations that serve food. Follow these 3 rules, you'll be a happy camper. You get through med school, you don't have a problem. Getting into our med school in Bradenton. We have some requirements, just like every med school. The 8 credits of bio, 8 credits of inorganic, 8 credits of organic, 8 credits of physics. We have 6 credits of English, and then 6 credits of some sort of behavioral science, like philosophy, social